Hi everybody, it's Amber. I have just been majorly busy. I haven't been able to keep up with my blog as far as writing, so I thought that I would do a video blog to not only show how I'm doing, but to tell how I'm doing. Um, I am now going on, I would have to say, 4 months post-op from my partial gastrectomy with my Y and Rue. Obviously, if you've read my blog or if you know me, I had some very severe complications. I probably spent a good 2 months in ICU, hospital, and rehab. But I am now home. I have been off of all feeding tubes for a month now. I have no draining tubes. I've still lost a lot of weight, but I am maintaining now at between 110 and 111. This was one of the biggest fears that my surgeon had, was how much I was going to lose because I didn't have much to lose in the first place. As far as what I'm eating, I know that I'm eating a lot of things that most people that have had gastric bypass surgery, they consider trigger foods, or they genuinely have issues with. And I wanted to share with everyone that I think it I think people think I'm still very sick. Now, don't get me wrong, I'm not 100% out of the woods yet. I still do have an ulcer issue. However, 2.5 weeks ago, I had my endoscopy since all of the craziness, and it did show that one out of the two ulcers has completely healed over, and the other one is on its way. So I'm still continuing to take my Carafate 4 times a day, and I'm really hoping that that goes away and the gastritis in my pouch goes away. As far as eating goes, I am eating cheeseburgers, Chinese food, rice, sushi, not the raw fish. I want to clarify that. Something like California rolls that contain veggies, and imitation crab meat, I guess you could say. I've had the sweet and sour chicken, but not the sauce. I've been upping my sugar intake slowly. There was a point where I couldn't have more than 6 grams. If I had more than 6 grams, then we all know, or at least if you've had bariatric surgery, that I would go into dumping. Um, I haven't had uh, maybe but one major dumping episode since I've been home from rehab, which is fantastic. I think my body is now getting used to the way that I'm eating, which is a lot of junk for some reason. I don't think it makes sense, but everyone else seems to think it makes sense. I can shovel more junk food down my throat than actual raw healthy foods. The doctor wants me to gain more weight, even though technically my BMI is where it should be. With society today, I was the way I was before. I was considered plus size to an extent, even though I liked where I was, but I kind of like where I'm at now. Finally lost those badonkadonk thighs that I hated so much, but then again, I also lost some other things that I didn't want to lose. But over time, I'm pretty sure that I'm going to gain that back, and my energy does run low very quickly, and it's probably because I'm not absorbing all of the nutrients from the foods that I eat. And when I say that I'm eating cheeseburgers and everything like that, it's probably only 3 to 4 bites. Between the bread, the cheese, and the burger itself, I'm done. My pouch is only about this big, not very big at all. And I eat constantly through the day. I do eat protein bars, and I also drink protein drinks. However, I drink a special type of protein drink, which I would suggest to everyone, called ProJo by Bariatric Advantage. It's a specifically made protein drink for bariatric patients, and what's fantastic about it is that it's only 3.5 grams of sugar, 5 carbs, and get this, 20 grams of protein. Now, we all know the protein is the most important thing that we can intake as bariatric patients, just for the healing. Especially for me, I know they wanted me to be taking over 100 grams of protein because I've been cut. I have a 10-inch incision from my sternum to my navel. which is actually healed now. I can take showers, baths, and the doctor gave me approval as of yesterday to start putting cream on top of it to help it fade. On a mental aspect, my scar does bother me. I don't like looking at myself in the mirror, but I'm sure as it fades and over time, I will overcome that, as we all do. I would really like to stress and open my arms to anybody that is having bariatric surgery, whether for weight loss or for the reason I had it, a rare condition called gastroparesis, which is paralysis of the stomach. My stomach basically stopped working, which made me very, very sick. And I've been very sick for a long time. Just didn't really have the doctor to figure it out until now. I have been actually kicked out of several bariatric groups due for the fact that the surgery that I had is usually for weight loss, and when they hear that I'm trying to lose weight, it's very upsetting to them, and that makes me sad because I have been attacked by these people and have been told that I am in no way going through what they are going through or what they went through. And I actually beg to differ. I actually think that I am not only going through what they have gone through, but more, in fact. Bariatric surgery is a very common surgery now in these time and ages, and the fact that I had such severe complications that nearly killed me, the people that know me, it was a very rough time in ICU, being cut open 3 times in 1 month, relearning how to eat, going from liquids to baby food to just like you would with your own baby, stage 1, then stage 2, where there's chunks in it, and then I had to work my way up. And it was difficult. It was hard. It's stressful. No, I don't have the loose skin that weight loss patients would have, but yes, I do have the mental scarring of the scars that I have. I not only have my 10-inch incision from my sternum to my navel, but I also have multiple scars around my sides where the original laparoscopic surgery was, as well as my drainage tubes. I had 5 JP drainage tubes in, and they were in for a long time. So I have multiple scarring that goes on with my stomach, and it bothers me. And yes, mine will fade over time, and weight loss patients, yes, I do, and I am aware that they would have to have surgery in order to fix that. But when I say I want to open my arms, I want to show support for my gastroparesis friends and gastroparesis sufferers that I've yet to meet yet, as well as weight loss patients, because I can support you. I can give you advice on what to try, because if anybody, I actually experienced more of a true dumping than most because I had a Roux-en-Y done. I no longer have acid reflux. My acid reflux was very severe, and if some of you have GERD, you know how bad it can be, and that's been fixed. And although I can only eat small amounts, and sometimes when I overdo it, I can get sick, I have to say I'm very happy. I want it noted that I am not laying at home depressed and miserable, and I can't believe this happened to me. What's done is done. It's over with. I love my surgeon. I can't thank him enough. Even though eating 3 bites, I am eating more now than what I have ever before, and I'm eating foods that I was not able to eat before since the surgery. I have a card that has multiple lists of food allergies that I am to stay away from, and I am eating them on a daily basis. I have gluten intolerance. I'm allergic to casein, which is the protein in milk, sesame seeds, vanilla, anything acidic, lemons, limes, oranges, etc., raspberries, strawberries. Pretty much I'm allergic to all of it, severely to tomatoes. I do stay away from the tomatoes even though I put light ketchup on my burgers. I have yet to have an issue with that. And I am also allergic to potatoes and sweet potatoes, and I am eating fries and potatoes all the time and not having any issues. And everything I eat probably has gluten in it. And I am perfectly fine. I am no longer fearing leaving the house, as I'm now kind of able to predict what my body is going to do. I wake up every morning kind of knowing how my day is going to go. Every once in a while I have a hiccup and I'm not sure how to handle it, but I do get through it. I have a lot of support with my husband and family and close friends. And I just want to say, with 4 months post-op, I'm really happy where I'm at. Um, I still am having to crush medications. Yes, I am still in a lot of pain. Just for those who I've been asked that, but I'm not so much in pain anymore from the surgery itself. Although I do have some twinges here and there from adhesions, but most of my pain is from my fibromyalgia and my back injuries, and now I'm finding out that I have developed some sort of hip issue where my bone, my femur, is grinding against my hip and my sciatic nerve. So, yay for somebody who's 28, but I'm happy, I'm loving life, I couldn't ask for more. I really hope that I continue to progress, and eventually I know that over time I will be able to eat a whole cheeseburger. And one day I know that you will too if you experience what I've had to experience. And if you have any questions, feel free to ask, write, email, text. I have no shame. If you want to see what my scar looks like, I have no shame. Or you can visit my blog, and it actually has all of my images there. But I do warn you, it is graphic. I did post a lot of surgical things on my blog page. So if you are squeamish and you can't take that, I suggest that you not visit my Weebly page and just private message me and ask me your questions that way. So everybody have a fantastic day, and I will try to update again soon, but who knows, maybe I might just stick with the video blogs. So have a good one. Take care.